You're all going to be like, you have to go to how many years of school to be able to teach that? It's not that hard. Really complicated, right? Because thinking about what we're thinking is a metacognition. It's a higher level of thinking that we don't just walk around all day like, what am I thinking right now? What am I thinking? It's just something that happens when we can pause and it becomes a skill, okay? But our bodies as humans are not capable of feeling an emotion unless there's a thought specifically turning it on. So most often there's a gap here. This is what needs treatment. Kids feel the anxiety. Adults feel the anxiety, but they don't know what specifically they're worried about or they're trying to avoid that's making them feel this way. It's oftentimes like just repressed anxiety. It could be major stressors, it could be trauma, but it doesn't have to be that serious. It can even be simply feeling like nobody picks them in gym class or they have nobody to pair up with at lunch. It could be something small. A specific thought, by the way, is not just like, I'm feeling this, it's something like, something bad's gonna happen to my parents when I'm at school. I'm gonna have a bellyache at school and throw up and mom and dad aren't gonna be there, or I'm gonna be embarrassed in front of everybody. You would be shocked at how common fear of vomiting is. I don't know if any of you know this already, but it is. Right. And what I always say is like, okay, we're gonna work on this. I'm not gonna make you love vomiting because that's weird, right? And if you already love vomiting, that's even weirder. So instead, we're gonna work on how can you tolerate the unlikelihood that you may vomit, but the possibility that it could happen. And you work on being aware of what am I thinking, how to prepare for it, how can I cope with it and function forward, and then only when the thoughts actually change, right, does it lead to different feelings in the body that then move to different behaviors. So oftentimes, the key is to change the thoughts. If you work with young people, and you all do, that's really abstract. Adults struggle with that even. So what we have to do instead is actually come in from this angle and change some of the behaviors that are happening. And the way we do that is through 504s and IEPs actually. But the hard part is schools oftentimes feel like this is a lot for us to manage, which it is. And parents are thinking, I can't send my kid to school because my teacher doesn't understand what they're going through, or they were denied for a plan. Now, don't get me wrong. This doesn't mean that every child with anxiety, right, is eligible for a 504 or an IEP. I want to make that really clear. But when it's approaching, standardized testing or socializing to the point that a child is really isolated or missing a lot of school, falling behind in work, we have to talk about what other things we can put in place, whether it's through even an MTSS or something else to rate help. So in treatment, what I would be doing is helping kids and families draw connections between this cycle that keeps a person anxious, right? So what am I thinking? How does it then make me feel? And what are the distortions that are happening? So if the thought is, I'm gonna go to school and throw up in front of everybody, right? Let's just ride that one for a second. Talk about vomit for a minute. Can it happen that a kid throws up? Yes, it can. How likely is it? Not very likely, unless the child is actively really sick. But the likelihood of even vomiting when a child is sick is low because they'll probably go to the nurse by then. There'll be other signs that people can pick up on that their child has malaise or is not feeling well. So if a kid continues to function through their fear of vomiting, even if they never see a therapist, even if they never learn how to control their thoughts, their functioning will actually improve. Their anxiety will actually improve because the arm of treatment called exposure therapy is actually helping kids learn how to pet the dog even though they're scared. But before they get there, they might have to watch videos of dogs or go to the dog park and watch them from a distance, watch their mom pet the dog before they're brave enough, right? It's a gradual desensitization toward that. It's the same with school avoidance. It's the same with any sort of anxiety that your kiddo is fearful of. If it's social anxiety, we can open this up to apply to specific examples. The treatment is learning how to tolerate distress and rewire your belief that you can't handle it, right? And the problem with the disconnect is if parents are so scared that this is harmful to send their child or that they have to face the things that make them scared and they don't have this education, they're doing nothing wrong. All they're doing is wanting to protect their child because they don't understand the mechanisms, the biopsychosocial mechanisms, right? What schools tend to do is not have enough of a graduated exposure to this, and so it feels unmanageable. The teachers oftentimes aren't getting enough education. The nurses aren't getting enough education on how to support this child. So we try to put them into the box that fits the most kids, and then it just quite isn't tailored enough, right? This is my anecdotal experience as a provider in working with schools. I talk with schools much more often than a common provider because I have the luxury of being in a position that isn't just fee for service where all of my time is in the class and in the session room. I coordinate and I help because fortunately I'm in a place that understands that that's all treatment too. I'm gonna pause. Thoughts, questions, and then I'll continue rambling. Yeah.
I think the first thought that occurred to me is that, I mean, and I've never been in the classroom, I've been in the classroom corporate setting, not, in the classroom that all of you are in, but it almost seems like in a lot of cases, we've been trying to treat the behaviors rather than going back to like almost the symptoms, rather than the actual root cause of what was causing everything, all the problems in the first place or what the kid was facing.
I agree with that. And it's nobody's fault, right? It's not somebody not doing enough, or it's simply we don't have enough dissemination of what do we know research shows to be successful for kids, and then how do we apply it in the different areas. We're not even good yet in this country, in the world, but there are places doing it better than us that know how to apply research for what works clinically to making sure that in every program, from social workers to LMFTs to even licensed psychologists, that they're using empirically supported treatments. There's a lot of talk therapy. You go in and you talk about the things that are stressing you out. Research has shown us that that actually makes anxiety worse because you're going in and you're talking about the thing that's stressing you out over and over again without actually making any changes to skill sets with our thinking and skill sets with our coping and functioning, right? So then we have all these kids that are in therapy, great, but it's not always targeting the exposure therapy they need. How to really identify where are their breakdowns, distortions in how they're thinking of things, right? They're not doing it on purpose, but they feel so convinced that they're going to be sick at school. And the other interesting piece to take and like teach your parents, teach your educators, is humans are the only living being that can actually predict danger and protect themselves before it actually happens. So plants and animals, as danger is happening, as there's a threat, they have the ability to protect themselves to a certain degree. As humans, we have the cognitive abilities to imagine outcomes, negative outcomes, and then make decisions ahead of time to try to avoid them. Great, except if you have anxiety, right? Or that can make anxiety worse because the simple thought of, I'm gonna go to school and fall in front of everybody at gym class, that is called a thought distortion, right? That's fortune telling. Meaning like it's a thinking trap that has you convinced that you know what's going to happen before it actually happens, and your body responds as though it's actually happening right then and there. So when you see kids scared and anxious, they're not making it up. They're responding as though that anxiety is right there in front of them. So then when we say, just get to school, that's inherently dismissive because it's not validating the experience they're having. Should we say, okay, you're nervous, you can stay home? No, but there's an in-between, right? Where we're going to talk about like what are some other things that educators and parents can do to reduce the accommodation of anxiety. The accommodation is a tricky word because in my field, accommodation is a clinical term, but in the educational world, accommodation is like a modification of some sort or something you do. So I'll make sure to try to clarify on that. That's why I sometimes insert like rescuing someone from distress. That's the same as accommodation, right? Any other questions or comments about that?
I would just say that I notice when in the absence of knowing how to like maybe systematically or structure that scaffolding, we tend to remove the obstacles. So that the student never really learns how to deal with that.
This is a perfect timing. So, okay. So remember we talked about anxiety increases, the natural response for each of us is to do something to make it go down. What we're accidentally doing is disenabling our parasympathetic nervous system. So the parasympathetic nervous system is part of the limbic system. Sympathetic tells you be alarmed. There's danger around. But remember, we just in our thoughts can turn on our sympathetic nervous system as though we are in danger in the same way with an imagined outcome as with an actual outcome. So right, that's tricky. When there's avoidance that happens, it teaches our body, okay, Now I feel better. I escaped that thing. I didn't go to school. I dodged social studies that I'm failing and I don't know how to talk to the teacher. Whatever's happening, right? I dodged it and I feel better. The tricky piece is avoidance actually does work to make you feel better, but only in the short term. It will continue to come back, and the more you respond and avoid, there's a contagion factor where more and more things become difficult for a person who's anxious, right? It's like it spreads. So it's natural for people to want to rescue them from it. As parents, that can look all kinds of ways. Safety behaviors might sound something like, okay, you don't have to take the bus this morning, I'll drive you to school to get there. Seemingly helpful, right, to get them to school. But if the bus is what's making them nervous, or they have separation anxiety, separating in front of the school where mom now is there, or dad is there, or grandma, is much harder than separating when the bus comes in, they're waiting for you, right? So are they gonna get on the bus crying? Are they gonna have to go in the school building crying or upset? Probably, but anxiety is not harmful. It's not physically harmful. It's also not psychologically harmful. What's more harmful to a person's development is missing out on age-appropriate functioning in different domains of life that prepare them to cope with the next developmental phase, right? So what I've noticed in schools that is well-intended is fast passes, right? Like just so well-intended. Kid is anxious, has a fast pass to go see social worker, support staff, or nurse. I totally get why. I also understand that some things have to happen in order for the class and the class period and the school to just the day to function. But what happens is kid is sitting there all of a sudden really anxious. If they have a fast pass, that means they immediately escape whatever the situation is, even if they don't know what's making them anxious yet, to go to someone else that now has an external source to walk them through that moment. It's not terrible because it's workable. If parent accommodations and school accommodations are moving a child toward the right direction of facing and working through their fear or their anxiety, it's not all bad. It's workable as long as it's a temporary phase that can be gradually increased. If it's just the whole year they have a fast pass, they're never actually learning how to appraise the situation, figure out what are my, I erased it too prematurely, what are my thoughts, right, that are leading me to feel anxious, and how can I restructure them? So this is why I talk to the social workers in your department, because I feel like there can be pointed pieces of intervention that take 5 minutes to help ask Socratic questioning, such as, what's the worst you're going to imagine happening if you stay in math class while you're feeling a bellyache, right? And you get to the bottom of it, not just like what's the symptoms I'm feeling that I have to escape from, but what's the root of it? And most often kids will say, I don't know, I just don't feel good. I don't want to be there. I can't. Don't make me go back, right? But you want to just gently push on that. Validate, always validate. I know you're really worried about something. I trust you're scared. I know your body doesn't feel well. And I know you're safe and you can tolerate this. Let's figure this out together. And if they're just, because you're going to get a gamut, right? You're going to get the kids that want that support, and you're going to get the ones that feel dismissed. They're going to tell their parents, and then the parents are upset, right? Or you're going to get the teacher that's dismissing of it and doesn't want to take the moment to get to the bottom of it. This is why I think the education piece is so important. And I don't know how else to get it to everybody other than to keep saying, let me talk to your group, or yes, I will come speak when asked, because I think it's so important that people have the right tools, because I truly believe in working smarter, not harder. And unless you go to school for clinical work, how are you supposed to know the CBT model or how to treat anxiety clinically? As a parent, how the heck are you supposed to know that? All you know is how you're wired, and when your kid is distressed, you want to respond to that. So it's not that it's wrong, it's just not the smartest execution. So decreasing over accommodation of anxiety is where I think that I'm hopeful we can have discussions around what that looks like. I think what complicates it is when kids have comorbid medical issues going on. Because quite honestly, I don't believe that anybody can have a true medical issue that's interfering with life and their childhood and not have any anxiety or depression or stress about it, right? Like if they don't, that's usually an indicator that they're at risk for something called a functional neurological symptom disorder or somatic symptom. I'll talk about it. So functional neurological symptom disorder is when a person kind of represses or doesn't adequately identify what's stressing them out or talk about it. And even if they do, there's kids that are still at risk. and then their body converts stress into physical symptoms. That could look like, did you just get hot in here?
Yeah.
Holy good Lord, I'm like, I know, I'm excited about this, but it's hot in here. So it can go anywhere from just the regular ones we see often, right? Headaches, belly aches, those are common indicators of stress. We all feel them. Sometimes like panicky attacks, physical symptoms that way. And it can go as far as psychogenic non-epileptic seizures, look just like a seizure, but when we look at their brain, there's no seizure activity. Very real symptoms that are happening to them. It's not fabricated or not made up, but their body is having these responses. There's kids who have gait changes, right? They can have leg weakness. I've had kids lose vision that are actually not responding to visual cues that we do in the hospital. Hearing changes. So we hear of adults like, yep, we know stress affects blood pressure, right? It's so much more than that. And so oftentimes there's this overlay of somatic presentations for kids who are anxious and also have medical, but it can also just be kids that don't have any comorbid medical issues, but have really strong somatic responses. I always self-disclose here, one, because I'm not shy, but as a child, I had somatic symptom disorder, but nobody knew what it was. I was a chronic vomiter, just constantly vomiting, but I wasn't your traditional anxious kid. I'm not an anxious person. I have super high empathy. And so when there's situations that I felt out of control or couldn't respond, I had physical symptoms and would vomit. To this day, TMI, this still happens to me. I just know what it is, and I know it's my body screaming at me saying, you're doing too much, you need to stop, evaluate the situation, take some things off your plate, or have a moment in between. So there are even times in stress, like my most stressful situations are child abuse cases, right? So if I'm in really heavy content and have to move to another, and without a break in between, I feel physically sick, right? That's just how my body is wired. And I always, in the beginning of my career would hold back because we're trained, don't self-disclose as a therapist. I'm human and you're human and let's relate. So I find that some people can understand that better because I'm not somebody who I would say has clinical diagnoses or can't function because I just was fortunate to be able to learn how to cope with it and didn't have parents who were anxious, so I just kept functioning, right? Many of these kids are the ones that end up in your nurse's office. And the other tricky part about anxiety is it can cause vomiting. So as we've talked about, so kids who are scared of vomiting can actually make themselves vomit simply by being scared of it. And then you have this like perpetuating cycle, right? So there's lots of layers of how this presents at school. And I was hoping to be able to just crack it open and hear about like what this is like from different perspectives and how we can meet kids where they're at. I don't know a lot. I mean, I know I'm pretty well educated on how things work in the school district just because of my special interest and I understand the law and I know the law on a lot of things, but I'm not an expert. So I want to hear about like where are the stuck points to how we can get kids back to school and back to functioning, whether it be procedurally or with parents, like what do they need more of from educators and from providers. But we want to reduce rescuing kids from distress, but we don't want it to have to be pull the Band-Aid off. You can do it in a scaffolded way that feels supportive, right? And I could keep talking about this. I'm going to intentionally cut myself short a little bit and happy to go into anything else. But what thoughts or comments or where are some areas where this feels like it resonates or you want to talk about specific ways on how to
Yeah, that's
Congratulations.
just something as a classroom teacher, but then also in the supportive role, I've seen when we do things like a 504 plan, people tend to want to put a lot of things that remove obstacles from students. And that really, in the long run, never really helps.
Nope.
Because you have to be very intentional about the plan that we're putting in place to help the student be able to tolerate.
So why don't we talk about some practical ones?
Yeah.
I also want to say that I think it's really tough for schools because when parents don't want to see their kid in distress or don't have the ability to tolerate it themselves, it's oftentimes parents that are asking for those kinds of accommodations, right? And then sometimes it's the path of least resistance. In my experience, there's a range of what parents are asking for. So fast passes, we can even talk practically about that. Or I'm trying to think of the ones that I get often. Giving presentations, talking in front of the class, raising their hand. What other ones do you guys hear your kiddos talking about or see at school often?
I don't think we call it the fast pass, but
Some
I think
people
we
call it
see
fast
that.
pass.
Yeah.
Yeah.
We even have some classrooms that are allowed to kind of leave the the room and go to that safe space, you know, type of thing.
Yeah,
In my experience, a lot of the kids that I worked with, they were able to at any point in a class and avoid the situation, and they could go immediately to the social worker.
yeah,
And you didn't see a lot of growth.
right. So again, well-intended. It's
Yes.
the execution that just needs some fine tuning. So what I usually do when working with patients and trying to develop plans is think about like a tiered approach. So first, I want the student to be empowered to use some strategies themselves to help themselves. So sometimes it's like I'll make with them, and this is a teacher can do this, is make an index card or have access to something in their surrounding that they get up in the classroom at any point to retrieve or have it with them, right? And the question might be specific to every child, but let's just say it's a kid that's worried about tests, right? I'm just picking things out. The anxiety with tests is what happens, and then they need to leave because it works them up into such a panic. Do we see a lot of test anxiety still? I don't even know. Yes.
I would say
Yes.
yes, but you know, I don't know that we always dig far enough to know what the root cause is.
I really appreciate that, honestly.
Yeah,
Yeah.
I mean, I think we see overall anxiety,
Yeah.
but I don't know that anybody says, oh,
That's what
we
this
know
is.
that's gonna be a
So
predictor.
this is what I started off with, right? There's a disconnect between knowing, like, what's behind all the anxiety, that if any educator, if all of the educators were trained on this, like, just to understand how to get to the root of it, I don't even know that we would need all these therapists. I mean, yes, there's gonna be a need, but it's just a specific way of questioning. So I'm gonna just ride with test anxiety, right? If you have figured out that a kiddo is fearful of tests, then I'm gonna say something out loud. Let's talk about it as though we already understand it, and then I'll go back to like, what do we do with the like FBA point of entry versus like trying to figure out what's going on with the kiddo, maybe through an MTSS or whatever. If we already know it's test anxiety, the question should be looking for evidence. So when we're trying to refute our thoughts that are leading to our behavior, our feelings, right? You can't feel anxious, you can't feel low confidence, you can't feel fear, you can't feel happy unless there's a thought turning it on. We just don't stop to know what that thought is. So if you have a kiddo that's actively anxious, and maybe this is what a fast pass or whatever you guys call it that goes to the social worker, maybe this is what they're doing because realistically it's hard for a teacher to manage this for all their kids and they have to keep teaching, like, let's be honest, I would never want to be a teacher. It's a lot of work. But if they can at least just say, go to the social worker, and the social worker says, what's the worst you're imagining happening? I'm going to fail this test, and then I'm not going to be able to move on with my kids. Usually it's catastrophic thinking for kids in that moment. They're going from A to Z really quickly. And it doesn't take a therapist to recognize that they're having irrational thoughts that can help to be refuted in that moment. But what we typically do is we feed reassurance, right? So we might say things like, you're going to be okay, you're a great student, get in there, you're all set. Not harmful, but not the most effective. What actually works better is for you to be a question asker. Well, how many times do you fail? How often do you fail tests? Oh, okay, so you've never actually failed a test. Or you failed once in 4th grade, or usually the kids that really worry a lot about this are the high achieving children that don't really actually fail, right? So you ask questions intentionally to get them to give you answers that are rooted in evidence, not this like imagined feared consequence or outcome. And then and I use a lot of mathematics with it, simple math, right? Okay, let's calculate this. How many days do you think you've been to school? Okay, you're in 7th grade, let's calculate, we have about this many days. You've been thousands of days. How many of those days do you think you've taken a test? Okay, 300. Let's just make, how many times have you failed? 1. Okay, so now we have an actual probability. What's the likelihood? And what you're doing when you're actually working that through with them is changing their belief in the distorted thought to align more with reality, and then it physically changes the signals that are riding their sympathetic nervous system, right? So their parasympathetic nervous system, which is designed to relax us, that's like the balance system. When we're anxious and avoiding everything, it starts to go on vacation and not be very active because it's like, oh, everything else is happening that I don't have to kick in. But parasympathetic kicks in naturally to habituate us so we don't stay at an anxious point forever. We can't stay anxious forever. That's just, we physically can't. And we can't die from anxiety. It is not physically harmful for your child to experience anxiety. It's uncomfortable, that's true, but it's not harmful. Prolonged exposure to stress and anxiety without treatment or intervention has more consequences, right, for long term. So that questioning piece, just to be pointed, can help get to the bottom of it. So let's say we don't know it's test anxiety yet, and you just know you have a kiddo that's constantly going to the nurse or whoever. The questions need to be, just a functional behavioral analysis, in my opinion, isn't just observing a situation and then inserting our own interpretations of what it actually is. Rarely do I see FBAs come back from schools that actually interview the child and talked about the specific reasons. It's just based on like, yep, we're sitting here doing this, got up to leave, went to the nurse while they were doing a group activity. But we don't know anything else beyond that. So asking questions like, what was your worst fear? What did you imagine happening if you worked in that group, right? It can be things like, is there something that you think you're not very good at that you worry is gonna make this hard for you? The other big one that's missed is we think of kids who are perfectionistic as being the kids who do things over and over and over again and want the extra credit and just get it just right. But there's a majority of the kids who are perfectionistic, but they simply don't approach or start something if they don't feel like they're gonna do it well or do it to completion or be able to do it to the standards of someone else. And so then they're falling behind in school, and then now they're school avoidant, and then when they're school avoidant, they have all this extra makeup work, and then thus the vicious cycle, right? So I think just the questioning and the being pointed at expanding FBAs to include a little bit more with the kiddo. Now you're gonna get the child that has low insight, that can't tell you any of this. But that's where also talking to parents and being able to say, like, what are the themes or patterns to this? When have you felt like this before? My favorite question, have you felt like this before? They say yes. And then I say, think back to that situation. Did something really terrible happen at that time? No. And then you always use their successes for when they've come out of something, when they've tolerated distress and still been able to do whatever the task is. You don't have to be successful only if you do it without feeling anxious. It's actually doing something despite feeling anxious that's a success. So being able to pull back on that. Remember last week when you were down in my office and you were worried you're going to throw up in class? And we encourage you not to call mom and dad and to stay at school and to see what happened. And then everything turned out okay. You had anticipatory anxiety, right? Your brain was anticipating something bad happening and then it didn't. You have to keep going back and like feeding the evidence that they can do something that they're anxious about, right? The kids who have a lot of school avoidance issues, again, I just anecdotally see most that have physical symptoms. I write reintegration plans that are slow reintegrations back to school, and I do it for a reason, because we're trying to interrupt how often they're going home early. I work with parents on not picking them up, write it into a plan that unless a child has a fever, I don't even say vomiting, unless a child has a broken bone that's visible or concerning, or they have a fever, we're gonna work on a health plan to keep them in school. And so our office usually writes notes to keep kids in school, even if they're vomiting, but isn't coupled with malaise or a fever. Because accidentally sending them home is now an avoidance, right? And so then they know I have to call mom, I have to get to the nurse, I have to do something where someone else can walk me through it. All well intended, just accidentally makes anxiety worse in the long run. I was going somewhere with that, got away from me. Oh, the somatic kiddos. Reentry to school, I usually do slow reintegration, but what I find to be the biggest tool is to use what I personally created as and call it a recovery day. So a recovery day is when you have the kids with belly aches. Maybe they've been having some psychogenic non-epileptic seizures or some physical pain, right? That we know is safe for them to function, but they're having very real pain. I always say, we need you to get to school. I don't care about the academics. I actually say this, I do care, but I say, I don't care about the academics. What I care about is you getting up and moving and getting circulation in your body and just getting to school and letting the school know that you need a recovery day. And then I realize this is difficult. I'm on a petition to try to get every school to have a location or a program in their school to help kids like this, because it's really hard to make it fit into the mainstream classroom all the time. But to have a space where they can go to, at their pace that they can feel comfortable with, work on makeup work, get the work from the teachers that day that they're going to be doing, and they stay there until they feel better prepared to go to class. And I would say 98% of the time, kids are usually in by the first period, if not the second. Because they're already at school, they've hit the biggest barrier, right, which is anticipatory anxiety. When I get to school, I'm not gonna be able to function. But exposure, when they get there, their body starts to habituate, their parasympathetic nervous kicks in. They're literally doing treatment and intervention by going to school. But if it feels like just go to school, you're fine, that's not supportive. If it's go to school and we'll give you a space and you can work your way through it, we know this is tough and we know you can do it, it feels inherently more supportive, right? Parents are more apt to send their kids to school when they feel like there's a supportive environment where their kid is understood. And it doesn't become, are your symptoms real or are they not? Because guess what, it doesn't matter. It's all still functional, right? So recovery day, I usually say, stay in school, And kids, instead of having a fast pass, if they otherwise had done their tiered supports, like they've tried to do a typical movement break, right? So many of us can just go get a drink of water and do a quick movement break and come back, and that can alleviate the environment change, get a drink of water. Have a coping card with some questions they can do right at their seat. If they've tried a few of these things, I would make sure that each kiddo who's in the situation has a check-in person. It doesn't always even have to be a social worker or a school nurse, but just a teacher who knows a little of what's going on, to ask a couple reset questions, right, that are evidence-based. And this is assuming people actually know, right, have access to this. I know it's a lot. And for parents to also know what kinds of things are triggering their kiddos, so when they come home, they can talk about that. So the schools need to communicate that to the parents, and the parents need to communicate to the school if they know what the specific worries are already. Like, what is it about the school day that's, because many parents do know already. So it's opening up that communication. If they've done that first tier, only then would I recommend something like a pass to go access staff to have more support with like working through that tough moment, not to go home or avoid the thing that's difficult. What would be best actually if that person says, I'm noticing that it's social studies, Johnny, and that's the class that you're falling behind on, you're really anxious about. How about we get you back there and let's plan to have you check back in at 1:30, right? And then we'll see how that went. So you don't facilitate the avoidance to completion. You help as a scaffold, send them back, but then have a scheduled support. The kids who are using FastPass a lot, usually I recommend that the school put them on scheduled support. So if they're anxious in class, they have a check-in coming in up during the daytime, so they have to sit with some of that distress a little bit and try to access skills that they have so they can build their tolerance and their belief that they can handle these things, that they can work through them, but then still have support. So the most severe cases, I'll start off having like 3 checkpoints with somebody each day. And so that they're not waiting the entire day to see somebody, and then we decrease in the scaffolding from there, or increase the duration of time that a child goes. I don't know if that answers more specifically about the kinds of interventions. There's a million different things.
I wonder though, sometimes I think from a teacher's perspective, they are not comfortable saying no to a student that says, I don't feel good. Because they've also had experiences where that has been a problem for, because parents don't want to hear that on the opposite side. So they tend to be like, okay, go ahead and see the nurse. In those cases, inadvertently, sometimes that isn't just, it's just an immediate removal, but it's hard to get them back.
Yeah.
And so then the manpower or the efforts to get the student to go back to class is equally difficult.
Yeah.
And to stay there without behaviors afterwards.
So this is why I think the job that schools have to do, especially in this day and age, is so difficult, because usually what I'll do is just say, can we, if nothing else, if the school can't manage anything else, can we at least stop the nurse's office and have it be someplace else that is a support but doesn't feel as comfy? And that's usually what, even with kids that have physical and medical, because we're trying to demedicalize their experience of anxiety, right? I oftentimes will just talk with nurses and train up, and it's a wide range, right? Like you have some old school that are like, get back to class, and then you have others that just like really can't tolerate distress. It's a wide range also. But that's, again, where I think like point people, special educators, to be able to help make sure that the support people know what they're doing in that situation. I think support that's not too comfortable is the best mid-ground.
So I think where I'm struggling right now, and I don't know if the teachers in the room can give me some feedback, is I'm just picturing you in a classroom with, 20 kiddos and possibly more, and you have 1 or 2 or more kids who are going to have some anxiety in the classroom, and trying to work through this while you're trying to teach all the rest of the kids during the day. And I'm struggling with how that can be functional when you get into your practical day-to-day that you're trying to deliver in the classroom.
Could I add something to that too? There are more issues that they're dealing with.
Of course.
So if you've got 2 that are anxious and you've got 2 that are hyperactive and they're worried about everybody else in the room, and then you've got 1 who has to go to the bathroom 20 times a day. I mean, there's a range of behaviors that it's really extensive.
It is,
And to manage classrooms with all of those things, and then you're supposed to pass RICAS. I mean,
right,
You're supposed to meet those
that's why I don't
demands.
want to be a teacher.
Yeah, I know.
Yeah, no,
It's just-
everything you're saying,
It's really hard.
and I want to make sure that as we're talking about this, right, I'm delivering like from a mechanism of what can help kids move forward. This is ideal, right? How can we find a mid-ground in that? I think the other thing that you just mentioned that sparked another area of passion for me is there are always going to be kids who have externalized behaviors, right? ADHD, oppositional defiance, all of that. I am going to go out on a limb and say I think there's a fair amount of kids that have behavior problems in the classroom, or even manifestations of their unmanaged ADHD that are rooted in anxiety.
I would agree.
And I got to go pee 20 times a day, also anxiety.
Oh, I would also say abuse.
So I think that there can be
There's so much
abuse,
of
yeah.
that is under, it's.
Yeah,
I don't
there
think we've
definitely
got a good handle
is
on
some
that.
abuse. I don't want to negate that. I
Yeah.
also want to make sure that the majority of people hear that even without abuse, these things can be manifesting on a daily basis, right? So it's not an either, it's not a this or that, it's an and situation. But let's just take the ones who want to go to the bathroom all the time, right? There's a function to that. Like, you don't have to have a formal FBA to be able to do a functional behavioral analysis to figure that out. Is it the kid who has trouble paying attention and they need that many movement breaks? If so, can we put an actual structured movement break into place or have OT consulted in a way that helps them have some in-classroom strategies so they can help themselves, right? So kids with ADHD oftentimes are the ones asking to go to the bathroom. They're not actually going to the bathroom, right? They're trying to get themselves some breaks. So can we do that better? The second is anxiety for kids can manifest as urges to have to pee or poop.
Yeah.
Like this is really common for all of us as adults, even if some of us want to pause and like think about our own bodies, right? So what is similar to a fast pass or leaving right away is every time a teacher says, yes, they can go because the kiddo's distressed and panicked, accidentally they're participating in the neural pathway being developed that I have to go until I feel some sort of urge and produce pee. You guys didn't know we were getting into these bodily functions today. It's anxiety. This is what happens. And what's better in those situations instead is to put them on, I do it two different ways, a scheduled pee break that has ample, right? So maybe they start off with 8 a day and then you decrease so that you're increasing the duration of time between. You can positively incentivize that with a behavior plan. You don't need a 504 or an IEP necessarily. Most teachers that are coming out of schools do some of this anyway, I've seen. Like there's a lot of good education for teachers around this. There are some gaps still too, and then another one is giving bathroom tokens. And they have 5 a day and they choose when they use it. So if they use them all in the front of the day, then that starts to work on their own rewriting of their internal narrative that I have to go this time. It starts to become, no, I have to wait a little longer because I want to have something the next day. And that changing of their thought process, remember, is what changes the actual manifestation of anxiety. So in the spirit of wanting to help a kiddo, we say yes, or as parents, we take our kid every time they ask to go to the bathroom. We say, go sit before we leave again, even though they just went. No, what they need is to actually say, I think your body's playing tricks on you because you're a little nervous about going. I'm going to challenge you to see if you actually wet your pants by the time we get to your friend's house. You do like exposure challenges. I'm all about bravery bucks for the young kids, which is doesn't have to be an actual buck. It can be tokens for moments that they're brave and they endure anxiety to do something that they're not excited about, that then can accumulate and cash in for a prize. At school, I don't think it has to be like prize box all the time. It can be homework passes. It can be a special privilege of being line leader, taking classroom privilege or something, whatever the child is motivated by. You can have in-classroom goals by turning in bravery bucks. And what I've noticed is that schools use a lot of token economies, right? So that's guided by research. But for kids that have clinical levels of anxiety or ADHD, those systems aren't reinforcing at a frequency that's high enough to actually make a behavior change. So it needs to be a separate behavior plan that's maybe every hour looking to see, did you stay in school? Did you use your coping skills, right? So there's ways to use positive reinforcement, which we know is better than like avoidance or escape. You guys are hanging, I talk fast in your head.
Can you talk a little bit about, I know you were talking about the recovery day and like sometimes some people might not be 100% on board with something like that, parents or teachers.
Yep.
And just seeing like that this really is a real thing that needs to happen to help the
I have to say, I actually haven't had any schools really push back on me. The pushback I get is just a logistical one, which is like we don't have space for somebody to go. But that supportive but not super comfortable works. So if it's the secretary in the office, or if there's an open classroom or planning classroom, what I think could work best is if it's not always just they go with the kids that have like in-school suspension or behavioral issues, because then that makes anxious kids more anxious and then they feel less apt to use it. But I think if there's a space, I know we certainly have enough kids in the system. I would recommend doing that, but I don't have schools push back often. Parents, yes. And the only reason parents push back, actually, I give a lot of psychoeducation. So I'm not saying it's not a hole in what I'm doing, because I'm sure it could be, but they understand the rationale. What they don't trust is the school understands it, is gonna know what to do to support or make them feel badly that they're using it. Like that's the piece that usually families have a resistance to. Either based in realistic concerns or their own feared outcome, right? Both. So when schools can also back the rationale to say, yep, just get to school. And we call it a paced reintegration. So with kids that have been hospitalized or kids that, have intermittent issues getting into school consistently, all I actually care about is that they're there every single day consistently to break the cycle of avoidance. Even if they're only there for half day for 2 weeks, and then we'll add a class period and then move them back. So you're slowly doing exposure therapy to school and their fear of functioning at school, right? Which are very real fears, they're valid fears. They just want to know that they can be supported at school. So oftentimes those I think of as front-end investments. Are they still missing out on work and compromised educational experiences? Yes, but also the alternative of a chronicity of this to me feels like I have to weigh which is the lesser of the evils.
Right, if it's gonna benefit in the long run.
You get it, yeah.
But I think to your point, Caitlin, I think sometimes maybe when a teacher experiences the help within the school, like through their targeted team or whatever kind of support team they have, maybe we're not doing the best job in the why, because I think from listening to your rationale, it's very intentional, right? Like there's a reason we're doing this and it's not gonna stay here forever. And I think sometimes teachers worry that I have to get through these standards and I have to get through this curriculum. I can't let him or her escape every day at that time. So understanding that scaffold or those steps to getting back to where we want to be.
Yeah, exactly.
And having faith in
because
that.
Because I think it's just not common knowledge that intentional process is quite literally therapy. It's an intervention. If they were to come see me and get exposure therapy, I would on the outside be working on, mom, dad, drive the child to the school 3 times a day when they're not going to school, to sit in the parking lot and watch the other kids and see the teachers moving around. Exposure. Then once all the kids are in on a morning day, you're walking them to the classroom and you can go home after. But until we start attending school on this day, here are the steps it's all intentional. It's all gradual exposure. You can do the same in the school. And does it take extra attention in the beginning? Yes. But again, I think it's that front end investment. Are we targeting and treating and supporting what it is it's actually going to help, right?
And without that why, maybe it doesn't feel like worth the effort, because a lot of times the teacher will go to those teams and feel like they're leaving with a lot more to do. You know what I mean?
Yeah.
Unintentionally, because they're getting a lot of suggestions, but not really grounded in the why we're doing it.
Yeah.
I mean, that's a guess.
I also think we're at this this place in our education, in our society, where school is going to look a lot different moving forward than it has in the past because of pandemic, because of this mental health pandemic itself that we've been having, right? So I was looking for a bathroom as I came up here, went around the corner, and you have a nice little mental health section right over here on the right side. And I think that's great that you have it. I think that you all know this, I'm preaching to the choir, but districts need to hire more mental health support or fold it into curriculum in a certain way. There just needs to be. When Tollgate has two social workers for 1,300 students, I think it is, come on. The fact that there isn't constant turnover in providers, but also frustrating for kids and parents, it's just not, we need to do better. Because it's there whether or not we want to employ people to help support it. It's not going anywhere. So I do recognize right now it feels like a void, but I think if we can get more intentional in these things, we're going to see mental health be part of the school day, the same way they're teaching young kids mindfulness, right? And diaphragmatic breathing and how to stop and think first before responding. I never had any of that when I was in school, right? So we're already doing better than we were. But I think if it's overwhelming for the teachers to deal with, at least if the support people that are on the receiving end of the fast passes or whatever you're calling them, then even that is a starting point to be able to help those people communicate with the parents about why we're doing things a certain way. And usually when kids are in truancy, I say, this is the reintegration plan. As long as you're following this, the school is going to be considering that day a completed day and not a miss. So you need, and then other than that, then we call DCWF ourselves, right? Because we're offering the supports in a strategic way, and then the family's choice if they can tolerate distress or not.
You just brought it up, things are different than they used to be, I can talk to that, but, I really think that without a link to technology and what's happening with the technology utilization in the classroom and the mental health of the students using them, I think that's a huge problem. And I don't see anywhere I think for teachers, the management of the usage of telephone is out of control because it's not within the teacher's control to say, there's no system for getting rid of those cell phones in a classroom.
No, I think
where
that's
they
actually the
don't belong.
norm now for kids to have them and have access to
Have
them
them
most of
in
the
the
time.
time, right? Isn't that disrupting? In a middle school and high school, I think that, I have I have limited exposure to middle school because those were tough days when I subbed, but I'm appalled
Yeah.
that there is, I just read that in Connecticut, they're experimenting with a pouch and the kid brings a
I've seen it
phone to
too.
school, and they
Like at a
have to put
concert.
the phone in the pouch and it cannot be opened until end of school day. They can walk with it.
Yeah, and this is where we need parents and educators to come together
We need
because
to go.
how many parents are gonna go in and demand their kids'
And
phone
then
comes back, right? when
On the
it's
other
certain
hand, the
things.
parents are spending, that's a $5,000 to $1,000 expenditure
Mhm.
for an 11-year-old.
Yeah,
They won't feel the pressure
right.
the
We would
parents
have
won't feel the
to-
pressure to buy, everybody's in cell
We're gonna have
phones.
to schedule another hour and a half talk just on technology. because I know we go on my soapbox for that one for a good
But
amount
what
of
I'm
time.
asking about is the mental health of the kids.
Oh, yeah, well, think about even just access to, and the word bully is thrown around so much now, right? But not
It's true.
everything is bullying, but there's still, when we were younger and in school, when you left school, oftentimes the bullying kind of ended and then you didn't have to be exposed so much. It's relentless and people are, exposed to so much more because the instigators are hiding behind, the screen and say much more egregious things than before, or
Absolutely.
there's the group
Threats.
effort and then there's this diffusive responsibility. Like
Mm,
it is a really difficult thing. And I do think that perpetuates higher anxiety because
Yeah.
a person is experiencing anxiety at a much higher frequency than when it was just at school and then they had some reprieve, right? It's just, it's constantly there. I don't have any fixes on that, except that every single family I see, I work on limiting access to screen times and helping to educate on what that does to the brain and how all the social skills are being negatively affected by technology. So,
And sleep
that's
time.
right. Yeah.
Okay,
I think you're gonna.
Yeah, I had a question, this is something that schools struggle with is, and you touched on it briefly, that, so the kids that don't come through the door. So, we can have all the plans, the reintegration plans that are gradual, and we have, our support centers that kids can go to as soon as they get there, and things when they're feeling up to going out to classes, they go out to classes. But if they don't walk through the door, there's nothing that schools can do, but often we find that we're held accountable for the kid not coming through the door, and I'd like to come up with some collaborative way to work with families so that we can be part of that. But like you said, it's like driving to the school and
Do
doing
you
that 3
feel
times
like
a day. or
that you
whatever.
have the opportunity, I don't know what communication is done with the families ahead of time on this, but do you feel like there's a platform or a space to be able to deliver education on the rationale for why to get there? Before even talking about a plan, like what's happening developmentally, what's happening neurobiologically by missing school? Like, is there a space that you could insert any more of that pointed discussion?
With families?
Yeah, to educate them on the why before getting into this is what we're doing.
Sure, and I think that our transition plans back from hospitalizations
Yes,
or coming back, whatever, we try to have those meaningful conversations, but a lot of the times after that, we're kind of out of the picture and we're trying to play catch up and trying to contact parents and trying to figure out where they are and what they're doing. And ultimately it ends up in truancy, which I think that's.
I just think that we're
it's
never
not
gonna be
really
able to
fair.
avoid truancy. Like, there's gonna be some of that comes up. The reason I was asking is there a point that there could be change or improvement on school side? I think you guys hired someone, I worked with her in the past, that does this transition from hospitalizations in Warwick, right? Isn't there a special position for that? There was somebody hired, wasn't it Andrea?
Oh, no, well, Andrew, because the Kenny Bento, so that's.
Oh, is that right?
Is that, I don't know, the last name sounds, there was somebody that Warwick hired, I would say probably 5 or 6 years ago around now, that okay, that was, her job was a liaison specifically to help with kids transitioning from medical and psychiatric or medical psychiatric admissions back to school.
I don't know that.
And I coordinated
And
that.
I've been here for a while.
But I also wonder about like
I was-
sustainability,
There's
right?
There was an out-of-district coordinator, but I don't know if
No,
that
she was
would be
part
the
of
same
Warwick.
thing. Yeah,
Because
she
I'm
was part of
thinking
Warwick,
Warwick is
but-
cutting edge, they're doing great things.
but
But
one of the
funding-
assistant director positions was
But I don't remember.
at that, but I
It
don't.
could be funding and sustainability too, that was
Yeah.
an issue for that, and maybe Andrea's the wrong name, but I know for
Yeah.
sure there was somebody hired that did some of this. I don't know, I think it's the reflecting on, is there a space to deliver even better education if they're not seeing a therapist, and then that's what that's what the school can do, right? Like, you're doing what you can do, there's some families that just don't have access. Do you often make referrals to like Tides and other, you do?
Yeah.
And is there
Yeah,
anything?
we try and, work with the courts too, because they have
Yeah.
a lot more leverage than we do,
Yeah.
those kinds of circumstances.
Yeah.
Are working on it.
And we have a MOU with Thrive, and we have a school
Yeah.
liaison for that program, but, it's really just,
Thrive like EOS or in school, like outpatient?
she's really just partnering with us just to give like any support to our, support staff and counseling and stuff like that, but, yeah, it's one of these things that's difficult, and that's just transitioning programs, but I think what I heard was more like,
The ones that you,
it's very hard to get parents to come out to listen to things, and there does need to be more tier 1 attendance matters, and we are doing that right now, because I think it's easier for parents to just say,
Yeah.
I'm not gonna fight that battle, whatever it is. But yeah, that I think has been tricky, like, if we don't have good contact with parents,
Yeah.
social workers going to the house or
Yeah.
trying to, and they're not engaging, that's the hard
I mean, I
thing.
think this is why, I'm gonna preface this by saying, I think it's a frustrating response, because it's not immediate. It's the same as when families come in and their kids are having lots of tantrums and behavior issues, and I'm working with them on developing like different behavior management strategies. There's nothing that you can do in the moment when it's already reached that crisis. It's more about how can we change a culture? How can we change a system to be catching this earlier when that kid was in 2nd grade? Like, what are the things that are culminating in a very specific why? So that the school avoidance by that time, when they're actively refusing and parents aren't on board because they can't tolerate the distress, it's hard to disseminate that information to the parents and the kiddos when it's gotten to that point. And then you have to just rely on these systems that, have holes too. I understand it's frustrating,
And even
but I don't know that
the
there's.
court situation, a lot of attention gets, rightfully so, to the secondary schools because, they are not gonna graduate. But if we catch this earlier many of these kids have that trend all along, not coming to school.
Yeah, you look back at it and you can see little
Oh,
pieces that were.
absolutely. And I think, often we don't get a lot of court support for the younger students
I
or
agree.
even time with that.
Yeah.
And so a lot of our educators feel like that's backwards, that needs to be shifted. But I get the other reason too. I mean, we have kids that are never going to graduate if they don't
Right,
have any.
right.
That doesn't work in a lot of cases. By the time you're in senior year, the behavior is already.
Exactly.
It's
Many,
ingrained,
many,
right?
yeah.
It's been reinforced, it's
Yeah.
repeated,
Yeah.
has a function to it if it's continuing.
Yeah.
Behavior is only repeated if it's reinforced, right, in some sort of way. So,
And unfortunately, when they're younger, the courts focus on it's the parents, and the parents are the ones that are being charged, and instead of providing them the help and support that they need to work with their kids.
Yeah.
in school, so.
yeah. And it's been frustrating as a provider because I see the kids that are just, the defiant, externalized anxiety. And then you have those that have true debilitating social anxiety but are refusing any help, and the parent is doing all they can. And they will talk oftentimes about, DCYF is they, will talk about foster placement or moving to a group home or something else. And I rarely ever actually see it happen. And so it's this empty threat, which we know in behavior modification is like the thing you say, it doesn't work, right? It's the thing you want to stay away from the most. So it just feels really broken. I think just having the space to commiserate on that feels like, but it is, it's challenging. I don't know if I have any magical suggestions other than how can we start doing this more intentionally?
And I think that is something that our district is talking about, like making sure we're educating as much as we can for parents to understand why
Yeah.
every day of instruction is important.
I can't tell you how frustrated I am for schools and families when I hear, oh, you already have a 504 plan. Great, what accommodations do you get? They can't even tell me what their accommodations are. Teachers are overwhelmed with stacks of they just sometimes feel like meaningless formalities that aren't actually doing what they could be doing and are more stress on the educators to have to keep having these meetings for, right? So I know that this is a big thing to fix, and I'm not meaning to minimize the efforts that are there, but I just think that if we can have this idea of like getting to the why more and spending that time, you're gonna have something you spin your wheels and you can't keep investing to try to find it, but there are others that it's gonna be right there. And oftentimes when I have parents go home and ask their kid, like, well, what are you scared is gonna happen? Or what's your biggest fear? And they say it, it's like, oh, okay. And then it's workable. Then you have a dialogue now, right? Then you can actually support them with figuring out how to work through it. Most often that anticipatory anxiety, it doesn't take long if a parent learns how to validate it and encourage and instill confidence, right? I know you're worried about going to school and I know you're gonna be safe and do it. So you're not saying, I know you're not gonna feel anxious. You're saying, I know you can do it despite anxiety, right? I know you have the ability to think through that, or you know who to go to when you get to school. And then when a parent or an educator doesn't continue to participate in the accommodation, it holds space for exposure naturally, right? And then that's what changes the mechanisms, slowly but surely, not a miraculous, though I've seen it, but it only takes a couple times. It's usually just part of a plan when people are consistent. The other hard part is you sometimes have just like the personality pieces where one teacher has a harder time and all it takes is like one breakdown in consistency for something to feel like it's not carrying its momentum, which can be challenging. But what time is it? Is this all right? This is
No,
fast.
it's not.
I'm like, this is
7:20.
Okay.
I wonder if to a part of like, talking more about the why with teachers and families and having hopefully maybe some more professional development for teachers and families. One of the things I picked up on that you were talking about was like reset questions and like even having that as like a visual for teachers, just like or like even up in the classroom that kids could go over and look at and like.
I think
Just
so
keep
that's
in mind
another thing.
and-
I think some teachers, I've been into some classrooms that are amazing what they have in there. But even having word banks or visual feelings cards for kids early on, to have them in the midst of feeling that fight or flight or freeze, right, of what happens to them, to tell you what it is that they're worried about, forget it. Like their brain is in survival, fight or flight, I don't feel well. But if you can simply slide a deck of cards in front of them and say, I know you're uncomfortable right now and you're anxious, I wanna better understand that. I wanna be able to help and better understand that. Can you look through this and set aside the ones that you're feeling right now? What you'll usually see is it's a system overwhelm, like a system overload because they're feeling more than one emotion. And they don't know how to verbally articulate it. This is true for adults too. So even having visuals in the classroom that teachers can just hand to a student. In therapy, usually what I do is I don't even talk about it further at first because kids will resist it. Right? They don't want to do it, it's extra effort. They don't want to be vulnerable, they're uncomfortable, feelings are hard. Usually kids struggling have a hard time talking about their feelings, identifying their feelings. So usually I'll look through it and say, oh, you're feeling overwhelmed, disorganized, and nervous. Thank you, that's so helpful. Now I know how you're feeling. And then I move on. And all it's done is it's like created a quick dialogue to allow them to know how they're feeling so they feel at least understood or validated. Doesn't even have to do we don't have to fix anything in that moment. It's just creating that openness. Then I might do it to say, what's having you feel overwhelmed right now, right? Or is there something about the environment? Is it something that happened today before school? Like asking specific questions. I think having a word bank for some kids where they can just do check-ins, like scheduled check-ins for teachers. If kids are having trouble with transitions, right? And we know that the FBA says they struggle between library and lunch, right? Then let's figure out what is it about that. If we can even just start off having them circle pre-made words there so they don't have to retrieve or think about it, so we can get an idea about like what they're thinking or feeling, or if they're shutting down with a particular task. I hear it all the time and it just irks me at first when teachers are always like, they're so task avoided, they're doing that to avoid their work. I hear it all the time. Yep, and why? They're not doing it to be bad. They're not doing it to, so some kids might, right? But the majority aren't.
That it's more of a generalization. It's one bad experience has painted that whole
Right.
picture that it's always that way.
Right, and so then what happens when we feel like someone is misunderstanding us? it does for kids, it doesn't mean, oh, I gotta fix that and make it better because I don't like that. No, you get more of the same thing, right? You get more acting out, you get more isolating and withdrawing. It just perpetuates it. So that why is so important, so that just feeling like my teacher understands that I'm nervous right now and is using the word that is describing what I'm actually feeling can really help create movement, right? And make them so much more apt to want to go to school because, or tolerate going to school because they feel like at least somebody there isn't thinking that they're a bad student or that they're,
Talk to you, because
Right,
you
right,
understand,
right.
you know.
And maybe they'll come to you. I think another one that is good is if a teacher can come up with some sort of like code word or signal with kids, especially anxious kids who are scared to raise their hand or even access the accommodations that are on their plans, to have a code signal that they can just like alert their teacher, and then the teacher can fold it in, you know, within a few minutes of being able to kind of come around and address whatever it is. I think for socially anxious kids who have fear of doing presentations, I don't love the just let them not do a presentation because that's total avoidance. I might start first with, you have to do the presentation. After class time, you pick 3 people who would like to be there or whatever. Or I'll bring a couple people, and then over time, over the years, you increase what they're able to tolerate, right? Like that to me feels like an intentional accommodation that isn't facilitating avoidance. Or kids who have social anxiety but have all these self-advocacy goals, right? Like they're not emailing their teacher independently or initiating help or support and they're falling behind, but just it's because they didn't understand something. I think it's helpful to have scheduled meetings with some sort of advisor if it's possible, or having a point person academically to go through and say, you write the email, then I'll look it over, and teach parents to do the same thing. Stop sending emails for your high school student, right? Like you can communicate, let's sit with them and write it together. But I think there's so many small things that you can't speak to how to make 504s and IEPs for everyone. It's really just understanding the why and going from there. How can we take that and gradually move it forward? But it is tricky. It's not easy.
Can you talk a little bit about selective mutism?
Yes. So selective mutism, I'm sure many of you have had interactions. It's a form of social anxiety. Oftentimes kids with language delays of some sort, like mixed expressive or receptive language issues or articulation errors or other delays can have selective mutism, but it also can occur in kiddos who don't have any sort of language delay and rooted more into social anxiety. So selective mutism in itself is a form of avoidance, right, of not engaging. Education to the parents for sure, to help them understand that although distressing to see their kiddo freeze up and look around, not helpful to talk for your child all the time. So establishing some sort of like broken record at introducing this, you know, if a teacher or somebody introduces themselves to their child right from day one, helping the parent understand, oh, this is Sarah. She's a little nervous talking, but I'm gonna let her respond to you with head nods, right? So then you start off with head nods, or we do the whisper technique where they whisper and then pass it on and then gradually have them whisper a little louder. All exposure therapy, all of it. And then the other thing we do is recordings. And so we have kids start off making very short clips of just even small common words like, hi, my name is, or do you want to play? That the teacher will help facilitate and have access to these videos so they can use them with peers and with other teachers. And then even for show and tell or other things like this to have the parents record and bring into school. And then small group interactions where they can practice. So pairing with preferred peers most often, but not all the time, because we don't want that to become avoidance either. So then you kind of fold in different peers or assigned mentors or buddies. That's a really abbreviated version, but I don't know if that, does any of that sound like stuff that's been done, or are you looking for more?
So that, I don't want to get into too much detail, but the student speaks at home.
Yep.
But does not speak at school.
That's almost always how it is.
Yeah. I'm a 4th grade teacher, so it's been
Oh, so this is going on for a while.
since preschool. And I think just as a school, like we've tried a bunch of different strategies as much as we can do. Like I'm not, a mental health provider, so I don't want to do like more harm than good.
Yeah.
But he does use right now he uses an iPad to communicate.
And we know that
Nonverbal signals.
there's no speech, like it's probably hard to assess him because he doesn't speak to it.
Right.
And has the parents ever provided recordings?
Yes.
Like lengthy
Like,
or just like quick?
so for example, if I needed something to be, if I needed to do like a running record on him or sight words or something, they would send in a recording of him reading.
And has the child ever had treatment? Yeah, so I think that's really tough, right, as a teacher or educator.
Yeah.
To recommend that, but Rhode Island has a really active chapter for selective mutism, and they have national conferences once a year that are even available virtually now for parents to join and learn. There are also a couple, I think one is out of Baltimore. There's 2 out-of-state agencies that offer virtual consultations and treatment planning virtually. But partial programs are also good for kids like this, so they can be in a supported setting with behavioral goals. I just I'm a CBT provider, but I'm heavy on the B. I'm a heavy behaviorist because all of us struggle with the like thinking part of things. But in this situation, I might also work with the kiddo at finding things that are motivating for him and having a behavioral plan where even if it starts off with little squeaks and interactions with his voice, can earn privileges, and yes, this gets in the way, and I'm not an educator, so probably this doesn't irk me as much as others, but I find most kids are really motivated by a homework pass. Like getting out of a homework assignment after successfully having, X amount of interactions or being able to reduce something. There's ways to find small in-classroom goals that might motivate him to do even the littlest. All it takes is to break the ice a little bit and then build from there. But the longer it goes, the harder it is to break that. Without it, it's actually shocking that he hasn't had any intervention. I know you're like, I'm preaching.
Yeah.
Yeah, that's challenging. No thoughts, comments, you guys tolerated my rapid speech. You all get a gold star on your behavior plan.
Well, we are pretty much just about at
Yeah.
time, and I think this has been a really rich conversation with all of us in the room, and some of us got questions answered that we've probably had for a while, and then others of us over on this side of the room probably have a little bit of discussion to have internally on potentially where we can take some of the ideas from tonight and move them forward. And for the teachers in the room, that's always the difficult part, how you go back to your classroom and you look at all these wonderful kids and go, hey, how can I help them with all these things that I need to also do in the classroom for teaching? So I just, it's a very, very complicated discussion, and I'm so glad that we had it. And I think all of us in this room have given ourselves a chance to make things a little bit better in our part of the world.
Small group, but it was a rich discussion. I appreciate all your questions. I was also going to come back just real quick before you end, because it came to me. Have you seen those reels of, there's so many, and if you're educators, you're on it, and parents, you probably look for teachers who do like journal assignments that are just like to the class and they can write to the teacher. Have you seen that, like the private ones? No? There's one was asking about like, I don't even remember what it was, but she was pulling really rich information by just asking like a writing prompt and giving space. I wonder sometimes, even if teachers just asked privately, anonymously for their kid, I don't think you have to do it anonymously because you want to know which kiddo, but asking them that it would be kept between you and them, what's the part of the school day that feels the most uncomfortable to them? Or what's something at school that makes you nervous and you haven't been able to ask for help or ask somebody or nobody knows this? It might be really surprising to see what kinds of things pop up, and they're not always the most glaring things that we think are anxiety provoking. So this might be interesting too, just to do a little bit of like intentional asking, even with the kids that aren't super anxious, just to have a pulse on your classroom. Excellent.
I want to thank you so much.
Yes, no, I'm so happy.
Absolutely wonderful.
Happy to come, yes.
And thank you to everyone who took the time tonight in our small and mighty group to foster a good conversation.
And the heat returns back to.
It was like
It was like, thank you for validating.